Thank you, CEO. It's now 11 o'clock.
Good morning, ladies and gentlemen of the media and the other distinguished guests. My name is Mzulungile Notikita. I am the Chief Executive Officer of the South African Medical Association. It gives me great pleasure to welcome you all on this important media briefing of the South African Medical Association, the constitutional challenge to the National Health Insurance Act. We truly appreciate your presence here today as we share with your good selves the critical information about what we believe to be the most comprehensive constitutional challenge of the NHI Act to date. Today's briefing will outline SAMA's extensive legal action contesting multiple provisions of the Act that we believe as the Medical Association will severely prejudice both doctors and patients alike. Now I want to maybe spend a minute on this one, that one of the distinguishing factors of the SAMA's the legal challenge of the NHI is that we represent the missing voices in all the legal challenges that have been filed before ours, where we represent the professionals and their patients. Our presentation will cover key concerns regarding access to healthcare, administrative barriers, financial feasibility of the proposed act, the impact on the public health sector, and the long-term sustainability of the South African health system. So, ladies and gentlemen, before we proceed, I have the honor today of introducing our chairperson, Dr. Mvuyisi Mzukwa, who will be leading today's briefing. Dr. Mzukwa is a distinguished general practitioner. If we can mute, colleagues. He's a distinguished general practitioner who's practicing in Durban. He obtained his medical degree and his diploma in occupational health from the University of KwaZulu-Natal, and is currently pursuing his Master's of Science in Diabetes at the University of Warwick in Ireland. Dr. Mzukwa's expertise extends beyond clinical practice. He serves as a medical ethics committee member and social medical affairs member, and also a review committee member of the World Medical Association. He has also served on the WMA's council. Additionally, Dr. Mzukwa contributes his expertise as a board member at the Foundation for Professional Development. With his extensive clinical experience and leadership in medical governance, Dr. Mzukwa brings valuable insights to our discussions on how the NHI will impact healthcare delivery in South Africa. Without further delay, colleagues, let me invite Dr. Mzukwa, our chairperson, to share the position of SAMA on the National Health Insurance Act and our constitutional challenge. I thank you. Dr. Mzukwa.
Thank you so much, the CEO, for that kind introduction. Good morning, members of the media. Today, the South African Medical Association is announcing the launch of what we believe to be the most comprehensive constitutional challenge to the National Health Insurance Act to date. Unlike other legal efforts that have primarily focused on Section 33, which restricts medical schemes once the NHI is fully implemented, or on private sector interests, SAMA's challenge is far more extensive. We are contesting multiple provisions that will severely prejudice both doctors and patients alike, raising fundamental concerns about, one, access to healthcare, administrative barriers, financial feasibility, the impact on our public health sector, the long-term sustainability of South Africa's healthcare system. Our legal action is driven by the real-world implications of the NHI Act, particularly the bureaucratic and structural failures it introduces. Let me take this opportunity then to outline some of the key issues SAMA is contesting. Every South African will be required to register as an NHI user before they can receive treatment. Without this registration, even emergency medical care will be inaccessible, a process that could take years to complete nationwide. A registration can only occur at accredited primary healthcare providers. Patients will then be forced to seek care at their registered facility first, even if that facility is overloaded or incapable of providing appropriate treatment. There is no clarity on how patient transfers will be managed in the system. Ironically enough, restrictions to one's area of registration undermines the very principle of universal access to healthcare coverage. This limitation contradicts one of the fundamental building blocks of a well-functioning healthcare system, namely robust information systems and technology. In our view, these are essential to achieve the universal health coverage vision. South Africans need a universal electronic health record system that is accessible at the click of a button, anywhere in the country and across both public and private sectors. Without this, the effectiveness of the universal health coverage will be significantly compromised. Complaints about poor service delivery will be handled by a single centralized investigative unit within the NHI Fund's national office. Given the scale of our healthcare system, this mechanism is wholly inadequate for timely or effective resolution of patient grievances. The Act lacks clarity on what services will be covered under the NHI. Our legal filing highlights 9 different conflicting definitions of NHI benefits within the Act itself. South Africa is embarking on a radical overhaul of its healthcare system without even knowing what it will offer to patients. Additionally, procurement of medical supplies under the NHI remains entirely unclear, raising serious concerns about supply chain management and stock shortages. Number 3, SAMA is particularly alarmed by the consequences the Act will have on healthcare professionals, many of whom are already stretched beyond their limits. Both public and private providers must meet impossible accreditation standards, many of which can only be fulfilled after registration, a paradox that makes compliance unattainable. South Africa's healthcare workforce is already under immense strain, as you can imagine. SAMA's expert analysis shows that a private sector surgeon currently works at 158% of normal capacity. Under the NHI, the same surgeon would have to work at 368% capacity for half the income, a scenario that is both unrealistic and unsustainable. The Act makes no provisions for insuring private doctors against medical legal claims, even though they will be required to operate within the NHI protocols. Medical scheme members and beneficiaries of RAF or Road Accident Fund, COIDA, and ODMOA will lose their current benefits. In fact, it will become worse because they are struggling even at the moment, which will be placed by an ill-defined, unworkable, and unaffordable NHI system. This represents a major step back in terms of healthcare access. Key decision-making powers will be centralized at the national office or national level, with no assessment of whether national government structures have the capacity to manage this enormous responsibility. SAMA's case is supported by leading experts who have assessed the financial, operational, and ethical implications of the NHI. 2 South African experts have provided analysis on affordability, the financial impact on doctors, and the feasibility on transferring key healthcare functions from provincial to national control. At international level, experts on universal health coverage, they have offered insights on whether the NHI is the only pathway to universal health care, including an analysis of countries purported to be the blueprints for the NHI Act. Now, SAMA, as part of the Universal Healthcare Access Coalition, has introduced a new reform framework to address South Africa's healthcare challenges. This framework outlines solutions to improve equity, efficiency, and sustainability in both public and private healthcare sectors. Key features in that proposal include separating funding and purchasing functions for better accountability, strengthening public healthcare governance through decentralization, expanding contributory medical schemes to ease financial strain on tax-funded healthcare, depoliticizing healthcare management, ensuring fiscal sustainability, and fostering regional cooperation. This has been submitted to the President for consideration as a viable alternative to the NHI system, which we deem fiscally unfeasible. I would like to stress that SAMA's involvement in the NHI development has been consistent and substantial since its inception. Our challenge today is not a sudden opposition, but rather culmination of years of constructive engagement. We provided comprehensive feedback when the 2011 Green Paper was published. We submitted detailed comments on the 2015 White Paper. We engaged thoroughly with the National Health Insurance Policy published by the National Department of Health in May 2017. We offered substantive input on the 2018 draft NHI bill. We continued our engagement with the 2019 draft bill with extensive comments. SAMA fully participated in parliamentary proceedings, presenting before the Portfolio Committee on Health and on the NCOP's Select Committee on Health and Social Services. Despite these efforts, the National Assembly passed the NHI bill in 2023, followed by the NCOP approval later that year. When the bill reached the President for assent, SAMA, as part of the South African Health Professionals Collaboration, formally petitioned the President to return the bill to Parliament to address constitutional concerns. Unfortunately, this joint petition, along with others, was rejected. Our legal challenge today represents the necessary step after exhausting all available channels for constructive input over more than a decade. In closing, colleagues, I would like to make it clear that SAMA is not opposed to the goal of universal health coverage. We strongly believe in equitable, high-quality healthcare for all South Africans. However, the NHI Act risks collapsing our healthcare system rather than strengthening it. Our litigation is about protecting patients, ensuring doctors can continue to provide care, and preventing the state from implementing a dangerously flawed system that could do more harm than good. The urgency of this legal challenge cannot be overstated, and SAMA is committed to realizing healthcare reform that is constitutionally sound and evidence-based, genuinely beneficial to all South Africans. I'd like to take this opportunity then to thank you for your attention. Over to you, CEO.
Thank you very much, the chairperson of the association. Colleagues, we will now take questions from the media. I need maybe to emphasize this, that the questions are from the media houses. Those are the questions we'll be taking. And we'll appreciate if the members of the media, they identify themselves first and identify the media house that they are coming from. And then we can take those questions. Thank you very much. We're now open to take the questions. I don't know if there's somebody helping me. Oh, okay. We've noted one hand. Are there any other hands online there? Is it? Zimkita? No other hand for now. Okay, maybe let's take the lady in front here. Thank you very much, ma'am. Over to you.
My question is that as Sama had indicated its intention to contest the NHI from last year, and the president had signed the bill into law in 2024 May. It's almost a year later. So the first question is why the delay? You had said that you had been in consultation with the government, but why did it take a year for you to initiate the constitutional challenge? The second question is the case before the High Court by the South African Private Practitioners Forum and the Board of Healthcare Funders. The president is contesting that it is a constitutional court question to answer. So I want to know from Sama, which court are you lodging this application at? Is it at the Constitutional Court, or are you also approaching the High Court? Those are regulations.
William, do you want to take that?
Sure, thanks so much. Good morning, everyone. A very good question. I think one of the reasons for the delay is the fact that this challenge that we're launching is probably the most comprehensive challenge out of all of those that have been filed thus far. It's informed by various expert reports as well as international experts, and that takes time, of course. The timing is also not incidental. There is a strategic element to it as well. As you are aware, there is currently ongoing litigation, and perhaps we wanted to see what some of the arguments and some of the other developments are before we actually launch our challenge. There's also been what we believe to be constructive engagements behind the scenes, where we had tried to see whether the president would maybe reconsider some of the actions that were taken through the UHAC, for instance, as mentioned. But unfortunately, that doesn't seem to be the case, and we're left with no other option but to bring this litigation. On the second question, the challenge of SAPPF and BHF is concerned with one particular matter, and that is the president's decision to assent to the bill and make it an act. He is contending that only the Constitutional Court has powers to review that decision. Our challenge isn't that. Our challenge is against the constitutionality of the entire bill, the merits, the substance thereof, and therefore the appropriate forum for such a challenge would be the High Court.
Ladies and gentlemen, I think I might have missed a very important issue here, that is introducing to you the panel in front of you. So I apologize for that. So the person who just spoke now is our head of legal, and it's Dr. William Oosthuizen. And next to Dr. William Oosthuizen is our vice chairperson, Professor Ames Dye. And I've introduced the chairperson of the association, Dr. Mvuisi Mzuka. Among us, we also have the former president of the association who is sitting at the back, former chair of the association, Dr. Jose Litape is sitting at the back there, who's attending this. So thank you very much, ladies and gentlemen. You can continue with your questions now. Are we getting any questions, Zee?
Not yet. You may continue to engage.
Okay.
If I may just ask one last question.
It's okay.
In Sama's arguments or in the announcements of this, you say that you are not against the universal health care, but however, your main contention is on the fine print of this bill. To a simple person who hears Minister Aaron Motsoaledi saying that the people who are contesting this bill, it's because people who are contesting this act, are people who do not want universal healthcare coverage. In simple terms, why is it important for Sama to take upon this legal challenge, despite your views that you are not against universal challenge?
All right, thank you. I think let me take this question. I think we need to first differentiate between universal health coverage and the NHI. So universal health coverage is the end goal of what we all aspire to. But how we get there is what we are contesting, which is the NHI in our case. South Africa has decided to take NHI as a vehicle towards universal health coverage. So we are contesting the how part of it, because we are saying if you are reforming a healthcare system, you've got to look at all the pillars of a healthcare system. At the moment, we've got about 6 pillars of a healthcare system. At the moment, we're only looking at one, which is financing. We forget about ethical leadership and governance, information systems, infrastructure, human resources for health, which we're still struggling on even today. So all we are saying is that if you are truly reforming a healthcare system, you can't then just focus on one pillar. So, and many other issues that we have raised here. So we agree, I mean, we're an affiliate of the World Medical Association that supports universal health coverage as it was initiated by the United Nations. But the how part, how we get there, is exactly what we are contesting.
I hope that covers you. I don't know if Vice Chair wants to add something on what the Chair just articulated.
So I also think, when you look at the pillars include the healthcare workforce and essential medicines as well. And we just currently look at the situation around us. 1,800 junior doctors unemployed, posts frozen, healthcare infrastructure run to the ground, lack of essential medicines. How are we actually going to get to those 6 pillars? A strong pillar is ethical governance, as our chair has stated. We look at what's happening in terms of governance, and we're very clear about the fact that it's far from ethical. We look at the corruption that we steeped in. Is anyone comfortable that the increased taxes that they plan towards the kitty for the NHI, is anyone comfortable that those increased taxes won't be pilfered away as well? We know that at the time of the pandemic, we looked at a parallel pandemic we were having in South Africa and in parts of the African continent, and that was corruption. Unfortunately, we're no longer steeped in COVID-19, but the parallel bit of the pandemic has not left us. We're still steeped in corruption. So is universal health care feasible at this moment in time? No. I think we've got to fix our house first before we actually go ahead and start ordering people in the country, citizens, the small pool of taxpayers, to increase their taxes just for those taxes to be pilfered again. I hope we've answered you comprehensively.
Can I just add just one more? To say that if you look at the NHI, you could look at it as a big medical aid that will be covering all South Africans. If you know how medical aids work, they do not purchase or they do not employ healthcare workers. They do not build hospitals. They don't buy medicines. They just purchase services. So if you have rural areas that are without clinics, without institutions, they will remain so, even under the NHI. So they still remain, there will be no access. In fact, it will not be universal health access. It will be urban healthcare access. because the rural areas will be without a reach in terms of those services.
Yeah. Okay. I think we've covered that question comprehensively. I am just wondering with the team online if you have any questions that are coming through, in the absence of which we might have to move on. Does the show mean we don't have any other question? Okay. I think
there's one question on the Q&A session. I don't know if somebody wants to read that.
Yeah, it's preferable that people must speak up so that we know where is that coming from. If it's identifiable who is asking the question, can somebody read that out?
We have Tanzan Metalakamp from Daily Maverick.
Daily Maverick.
Yes, Mr. Mutsoaledi recently announced that a stakeholder advisory committee with representatives of the health profession will be used to guide the implementation of the NHI. As a key organization in South Africa's health sector, has SAMA received any clarity about who will be on this panel and if it will be represented, if SAMA will be represented? Thanks.
Sure.
Thank you so much for that question. We have not received any invitation from the minister or even clarity on, that panel. So we cannot comment because we don't know. We've not been invited to be part of it as at the moment.
Yeah. Any other question?
William would like to.
Yes, William.
Chair, if I could just come in here. Again, as the chair had mentioned, it's been more than 10 years where SAMA had attempted to put our views across to the Minister and the Department of Health. And at every stage, it's been disregarded. So we have very little faith that our views will actually be considered in such an advisory panel. The mere fact that we haven't been informed or haven't received an invitation is already a strong indication of how this will go. And just looking at the NHI Act, and we'll send our papers to you and we'll show you the arguments and the expert reports. The Act is irrational. It is incapable of achieving what it seeks to achieve. It's unaffordable. So many of these sections are vague and cannot be implemented. It infringes various constitutional rights of patients, limiting their access to care. It infringes rights of practitioners, their choice of freedom of association, freedom to practice their profession. This cannot be fixed by now all of a sudden inviting people to be part of an advisory panel. We will continue to constantly engage, but we need to fix the fundamentals. I think UHAC have proposed a wonderful framework through which we can seek to do that. But we need to start looking past the NHI as a solution to reach UHC. The Act is a wish list and unfortunately unworkable, and to stick to it is just blind ideology or arrogance.
Thank you very much to the head of legal there. I don't know, colleagues, if you have other questions that are coming through, Renee. But because of time, we might have to move on.
There's nothing, Dr. Nodikira, nothing.
Okay. So, ladies and gentlemen, let me take this opportunity and thank our panel here and thank the colleagues who have joined us online. And I think as the head of legal has mentioned that we'll make our papers available to all of you. I think maybe we'll give them a timeline of about a week to make those the full affidavit available to all of you. So colleagues, let's thank you very much for your participation. And this marks the end of our press briefing. And thank you very much for everyone who's made time to come. Thank you very much.